Hi everyone, good evening, and thanks for joining us virtually. We're going to go ahead and get started with the seminar. Today you're attending a seminar on my family tree has a history of breast cancer. Am I at high risk? My name's Samantha Witt. I'm the genetic counselor at the High Risk Breast Clinic, and I'm going to hand things over to my colleague, Kathryn.
Hi everyone, thanks for joining us this evening. I'm Kathryn Vera. I'm the nurse practitioner at the High Risk Cancer Program. And I wanted to start off by telling you a little bit about breast cancer in Southwest Michigan. Breast cancer is the second most common cancer treated at Lakeland, and locally, more than 4,000 women meet the definition of being at high risk for developing breast cancer. The High Risk Cancer Program was designed to monitor these patients and fill a large community need. In 2017, the American Cancer Society reported that breast cancer deaths are down 39% since 1989 due to increased screening. This equals 322,600 lives saved. When we think about what puts someone at high risk for breast cancer, there are many modifiable and non-modifiable risk factors. Some of these factors include family history, genetics, lifestyle factors, and personal factors. Lifestyle factors can include diet and exercise, and those would be some modifiable risk factors that we would talk to you about. This slide talks about what it means to be at high risk. So normal average risk for a female to develop breast cancer in her lifetime is 1 in 8. So 1 in 8 women will develop breast cancer. This equals out to be about 12.5%. Women considered high risk for breast cancer have a lifetime risk of 1 in 5 or 20%. We get these percentages, they're determined by the Gale's score and the Tiracusic score, and these models are designed to assess your individual risk. And these factors listed are what is used in the Tiracusic model to calculate your score. I just want to describe a couple of these. Age at first live birth. Women that have their first child under the age of 30 have a decreased risk for breast cancer. Breast density is another risk factor that we look at, and women that have increased breast density have an increased risk for breast cancer because it lowers the sensitivity of the mammogram. Another thing that we look at is menstrual history, so starting menstruation earlier than age 12 or having menopause later than age 55 also exposes your body to estrogen for more years, and that can increase your risk for breast cancer as well. And now I'm going to hand it over to Sammy to talk a little bit about genetics.
Hi everybody, bear with us as we click. One of the biggest things that can really help us understand your risk is knowing your family history. And so I think a big question that a lot of people have is, what exactly does my provider need to know? And this goes for all of your healthcare providers, not just me as a genetic counselor and other people, but some things that you need to talk to your providers about are if you know your ancestry on mom and dad's side. We know that some ethnicities carry genes associated with increased risk of cancer at a higher rate compared to others. It's important for us to know who's had cancer and who hasn't had cancer. There's a difference between a family history of 3 to 4 aunts on one side of the family having breast cancer and then maybe 5 men that haven't, or someone that only has 1 aunt with breast cancer, but there's no one else. It's hard for us to interpret that unless we understand the whole family tree. It's important for us to know where the cancer started, and sometimes that can be difficult to know because, for some people it spreads different places, but if you can know the primary cancer, that's really helpful for us. Additionally, the age of diagnosis. That's really crucial because that can help, individuals like me, a genetic counselor, try to interpret if there was an increased risk for cancer because of a gene modification or something else. And then if you have treatment information, that can be useful to some of your healthcare providers as well. And as a genetic counselor, I'm always going to say that I need to know if anybody's undergone genetic testing in the family, if you know what those results were, if they were positive, if they were negative, but also what all was tested, because 10 years ago, we were only testing a handful of genes, and now we have panels of genes that are up to 84. So things are always evolving, and there might be new things that we need to discuss. And this is all very important because family history gives me clues to help assess your risk, but also your other healthcare providers. If they don't really know things about your family history, we may be missing things. So family history of certain diagnoses, specifically breast cancer in the case of our conversation today, may indicate that you are at a high risk of developing cancer or breast cancer. And we have different models we use. The Tyrer-Cuzick risk assessment score also calculates in that family history of breast cancers, but sometimes these models aren't perfect. And so it's important that we know other family history of cancer outside of just breast, because there can be associations with different cancer types, such as ovarian or pancreatic cancer. So in general, knowing everything helps us get a bigger picture for what's going on. But for me, as a genetic counselor, I look for specific patterns in a family history that may indicate that someone was at an increased risk for a specific genetic condition or an increased risk for cancer based off of their family history. And then even if someone chooses not to do genetic testing, a family history is still a vital tool to ensure that you're getting the proper screening. And Kathryn will mention some of this, but things like age of diagnosis of breast cancer can sometimes guide us to tell you when you need to start your breast screenings. So I'm going to hand things back over to Kathryn to talk a little bit more about our clinic.
Thanks, Sammy. These are the objectives of Lakeland's high-risk cancer program. We are committed to identifying patients who are at risk for developing breast cancer. We are delivering enhanced screening and diagnostic workup pathways. We have expedited breast cancer timelines and diagnosis delivery, and we provide genetic counseling before and after testing, as Sammy said. We are committed to a 72-hour turnaround time from biopsy to diagnosis delivery. So this helps reduce anxiety from the time of the biopsy to the time of diagnosis. The Lakeland Mammography Department identifies a Tyrer-Cuzick score, like I had mentioned earlier, and so this helps us to identify women that are at high risk for breast cancer. Like I said, a score greater than 20% identifies the women that are at high risk for breast cancer. What happens at that point is that you get a letter in the mail saying that you're at high risk for breast cancer, and then you are given information for the high risk cancer program to come and make an appointment with Sammy and I. The goals of Lakeland's high risk cancer program, the overarching goal is to save lives and also to increase cancer awareness. We do a lot of education on lifestyle modifications that contribute to being at high risk, such as diet and exercise, reducing morbidities associated with late stage diagnosis, and like I said, the 72-hour turnaround time from diagnostic imaging to diagnosis. And I think, see. We use the National Comprehensive Cancer Network guidelines for high-risk individuals. So women that are at high risk for breast cancer are eligible for an annual breast MRI in addition to an annual mammogram. An MRI never replaces mammography, so both are needed in high-risk screening. And then I'm going to hand it off to Sammy to go ahead.
Hi, everybody. I'm back. So a little bit more information about our clinic, just so you have an idea of the journey women go through, is it's kind of a two-part service. You get to talk to Kathryn about what I like to think of as more of our modifiable risks, or things that we can do about our risks, whether that's screening, whether that's giving people information about diet and lifestyle factors. And then the second part is part with me, so genetic testing, genetic counseling. So it's two services. I'm a bit more of the service that is, what are the cards I'm dealt from my genetics and my family history? These aren't necessarily things that we can change, but what can we do about this thing that we're dealt, these cards that we're dealt? And so I look for hereditary cancers. And I could go on for most of your night about genetics, but I'm going to spare you that. And just know that there are certain genes, and we get our genetic information from our mom and our dad. But if there's something not working with that gene and we're not getting what we need from it, that may put us at an increased risk for cancer. So that means that's an inherited increased risk for cancer. That's something that you're born with. And we know that all cancer is genetic, but it's whether or not am I born with this increased risk for cancer, or is this something that I accumulated in my lifetime? And hereditary cancers are not common. They're only 5 to 10% of cancers. And when we think about cancer, most things that we think about are environmental, such as smoking and lung cancer. But sometimes our sporadic or random cancers that make up a majority of our cancer diagnoses, we don't necessarily have an explanation for. But I look as a genetic counselor for that 5 to 10% of cases that are hereditary, because there can be significantly increased risks for cancers associated with that. So that's why I need a family history, because that helps me assess to see for the possibility of a hereditary cancer. And that brings me to red flags. So I look for these red flags in a family history to see if there's that possibility of having an inherited risk for cancer. And a lot of people ask me, well, what exactly is a red flag for hereditary cancer? We know that as we get older, as we age, we have increased risks for cancer. But when I see a cancer diagnosis under the age of 50 or under the age of 45 for women with breast cancer, that's a red flag for me. That doesn't necessarily mean that someone does have an inherited risk for cancer, but it points me in the direction that we may need to rule that out. Another example of a red flag is a bilateral breast cancer. So that means having breast cancer in both the left and the right breast. Another example of that could be having two primary cancers, unrelated to our talk today, but that might be colon cancer and endometrial cancer in a female relative. In the world of breast cancer and in the world of genetics and breast cancer, it's important for me to know if there's a family history or a personal history of ovarian cancer, pancreatic cancer, or metastatic prostate cancer, for example. These may point us in the direction towards a gene associated with increased risks of significantly increased risk for breast cancer, but other cancers as well. Another example of a red flag would be having 3 or more diagnoses of cancer on one side of the family. The example I brought up earlier was having 3 aunts on one side of the family with breast cancer. That might be a red flag considering the diagnoses and the age. There are several red flags that genetic counselors are specifically trained to recognize and discuss with patients, but these are just some examples I wanted to give you so you could maybe identify some of these in your own family history, or make sure that you're discussing these things with your primary care, any of your medical care providers. Which brings me to who should see a genetic counselor in terms of the oncology and cancer world. And I think that this can be interpreted in a lot of different ways. We think of the people that raise these red flags. So if you've had cancer under the age of 45 or 50, if you've had 2 or more diagnoses, or if you have, that family history of all of your aunts on mom's side or dad's side of the family with breast cancer. But I also think it's important that we make it clear that anyone can have a genetic counseling appointment. If you just want to know how genetic information can impact your risk of developing cancer, you don't necessarily have to have these family histories. If it's information that you want, I believe that you are entitled to have that type of conversation. And part of the genetic counseling process is potentially undergoing genetic testing. There's a lot of ins and outs of genetic testing that, again, I could talk hours about, but I'm gonna try to be conscious of time. Genetic testing may let me know that someone's at a higher risk of developing cancer, not just breast cancer. Some of the genes associated with cancer that we can inherit forms of from our mom and dad can have associations with all different types of cancers. If I know about a genetic mutation running in the family, having your genetic test results may help me lower your lifetime risk of developing cancer, but only in the situations that I know someone had cancer and they had genetic testing and I know there's a mutation running through the family. If someone without cancer gets genetic testing and I don't have a family history of genetic testing, it's a little more difficult to interpret those results. So genetic testing may not take away that need for high-risk services if I don't have an identified gene mutation running through the family. And like I mentioned just a minute ago, it can let us know if we need to look out for other cancer types to screen for. If you need to be doing more often colonoscopies or more skin checks, or if there's other things we need to consider for you, genetic testing may open that door. And some of our genes out there, we have medical management recommendations to consider. You know, there's some genes that have surgically actionable recommendations. There's some genes that just have screening recommendations, and there's some genes that don't have recommendations at all. So it's important that we have a conversation about the ins and outs of genetic testing and what you can get from it. And we share our genes with our family, and so it's really important that, you know, your DNA, your results impact everyone in your family, everyone that's your biological family. So based on your results, other family members may want to get genetic testing to see if they also carry a gene mutation associated with increased risk for cancer. So they also can start screenings or implement any medical management guidelines that could help catch cancer as early as possible. And we're going to go ahead and just get started with some questions. I know we had a decent amount of them, and so we're going to try to get going on that. The first question we have is, are these covered by insurance? And I'm going to hand this one over to Kathryn to answer for you guys.
Okay, are these visits covered by insurance? These visits are considered preventive visits for insurance purposes. So every insurance company is different. If you call the high-risk clinic, we can give you the diagnosis codes and CPT codes that insurance companies, that we will submit to insurance companies. And then we can try to walk you through that and help you with the insurance questions.
Okay, the next question we have is, where is the high-risk cancer program located? And I think that's a great question because it gets a little confusing when you have the term cancer. And we have a lot of our patients that accidentally go to the cancer center. We're actually located in the Center for Outpatient Services on Hollywood Road in St. Joe. So if you've ever had a mammogram or a blood draw, it's that same building, that same entrance, and we're located where the Center for Outpatient Surgery used to be. So if you've ever been in that area, we're right over all the way on the right in the building. The next question, is genetic testing a requirement for seeing a genetic counselor? And I firmly believe no, it isn't. You can come and talk to me to understand what the impacts of your family history are, or genetic testing, and what genetic testing could give you, and not undergo genetic testing. I have some patients that decide it really isn't a good fit for them and that they don't want to move forward. And I believe that you're entitled to as much or as little information about your genetics as you're comfortable with. And even if we don't do genetic testing, we can have medical management recommendations we can make based off of family history. For example, if I have someone that's been diagnosed with breast cancer in a family at 38, The recommendations by these guidelines, the NCCN guidelines that Kathryn mentioned earlier, recommend that we start breast screenings 10 years prior to the earliest diagnosis. So that may mean starting breast screenings at 28 compared to 40 that the general population has. Moving on. And this is a really good question that I'll hand over to Kathryn. My mammograms, why am I at high risk?
Okay, and I get asked this a lot, that, you know, you get back your mammogram report and it's completely normal. So a lot of women are surprised that they are considered high risk for breast cancer. Mammograms are often normal in women at high risk for breast cancer. There are many factors that play a role in being at high risk for breast cancer. So some of these we touched on before, like family history, personal history, breast density. So if a person has factors that put them at high risk for breast cancer, that means that they may need to participate in hypervigilant screening. So those breast MRIs, in addition to the mammograms. And we can talk about that type of screening at the high risk clinic. So that's what that means. Thanks, Sammy.
Okay. The next question is genetic testing expensive? And I think in the history of genetic testing, it's always been viewed as something that is very expensive, but it's gotten more affordable as the years have gone on. If someone meets these requirements put out by NCCN that we use in our clinic and most insurance companies use to see if someone qualifies for testing, most people that meet these requirements pay less than $100 for genetic testing in terms of the panels of genes associated with increased risks for cancer. If you don't meet these criteria, it can be really dependent on your insurance if they'll cover it or not. Some companies that are out there actually offer a self-pay option of $250 without running it through insurance. So I like to tell everyone that it's about a range of the two, just dependent. And we'll answer one more question with our time left. So if I test negative, does that mean I'm not at high risk for developing breast cancer? And I think I answered this earlier, so I may give you guys an extra question, but if you test negative and you don't have a family history of a known gene mutation, that unfortunately doesn't remove the chance that there could be some sort of other factors associated with breast cancer that put you at an increased risk. So if I don't know if there's a gene associated with cancer running through the family, a negative test, although somewhat reassuring, is limited in my ability to interpret it. It may mean that there isn't a gene running through the family. It may mean that you just didn't inherit a gene running through the family. And it's difficult to really tell without knowing about the status of individuals that have been affected by cancer and if they've had genetic testing or not. And we'll do one more. I think this one's important, so we'll end on this one. Is breast cancer history on my father's side of the family as important a risk factor as breast cancer on my mom's side of the family? I think it's very common that we think that because, you know, breast cancer is more common in women, that we think mom's side is the most important, but we're finding that, especially in the world of genetics, that we get half of our information from mom and half of our information from dad. So both family histories are really impactful for understanding your risks for breast cancer. Although we see breast cancer more commonly in women, men can carry these genes associated with breast cancer and never have a history of cancer or have different cancer types that may not lead you to believe that you're at risk for breast cancer. And so it's really important that you talk about both sides of the family history, on mom's side and on dad's side, of all different types of cancers, so we can make sure that we're interpreting that and that we're making sure that you are doing whatever you need to be doing to prevent or stop or catch cancer as early as possible. Okay. So at that note, I think we're going to go ahead and get wrapped up. We really appreciate everyone coming. I know there's a lot of other questions and we really like to answer those. So you'll get a follow-up in an email format with those questions answered. And please reach out to our clinic if you ever have any questions. If you're wondering, this is a service, is this a good fit for me? Is it not? We're happy to talk to you on the phone to see if it is something that you'd be interested in and to get you in to come talk to Kathryn and I. We're really excited about this new program and we really hope that we're able to make an impact on this community. Thank you so much for joining us tonight, and we hope you get back to your cold evenings, unfortunately, but back to your evenings. Thank you so much.